As a mental health practitioner, I often find myself in conversations where some people try to qualify their difficulties as mental illness. And when a person says that I'm in this situation because I'm mentally ill, that means that they cannot be blamed for being in that situation. They're not at fault. And that consequently means that they are not responsible for that situation. But somebody has to take responsibility. So those around them will have to step up and take responsibility for this person. And you can see how damaging that can be to relationships if I have to take responsibility for you, or if you have to take responsibility for me. And we see this among teenagers and young adolescents. Not every challenge leads to a mental illness. Not every difficulty is a mental illness. In fact, stressful situations, adversities are just one of the risk factors of mental illnesses. There are many other risk factors that have nothing to do with life challenges. There are people who are generally having a very happy life but still suffer from depression. Financially, they're okay. Emotionally, they seem to be okay, or they should be okay, but they're not feeling it. So people using mental illness as a way of escaping responsibility is what gives mental health a very bad reputation, a very negative attitude, such that a person who actually has a mental illness will be ignored, will actually be dismissed, and care would be delayed to this person because people are hesitant, people are doubtful that this person may actually have a mental illness. And you can't blame them. And it is because of that there's increasing stigma on mental health. Young people, teenagers and young people, are supposed to learn how to have coping mechanisms. They're supposed to be able to have internal mechanisms that help them deal with difficult situations so they can be able to stretch themselves and build capacity for resilience. But because they don't want to try, they don't want to experience discomfort or difficulty, then they try to find easy way out. So we have many attempts of suicide without an actual diagnosis of mental illness before that attempt. They use it as a way of escaping responsibility, as a way of escaping accountability. And it's very important to make these distinctions, to go to a mental health practitioner, a qualified one, a licensed one, that can be able to assess you thoroughly and make these distinctions. People who lack coping mechanisms do not need a mental illness diagnosis. They need coping mechanisms to be able to deal with the difficult situations.